Okay. Hello everyone, and this is a pleasure indeed to welcome Dr. Samman Verma, a wonderful person, great achiever. Just to mention about his achievements, I have to mention here he has secured a rank 22 in PGI Chandigarh November 2016 postgraduate medical entrance exam, and not just that, he has also secured a rank of 34 in AIMS November 2016 postgraduate medical entrance exam. Wonderfully done. Congratulations to you, Dr. Samman Verma. How are you feeling?
Well, thank you for the wonderful introduction. It feels good that what you work for throughout the year, it finally does pay off. And also, the rank gives me a little more confidence that even in case I do not get the field I would desire to, I can still work further, maybe attempt it more in May, and even go better next time.
Well, definitely yes. I think you have done very well this time as well, but it is your call. Every of our listeners would be desperate to know that how did you prepare for this exam?
Well, that is a difficult question. In internship, I focused majorly on the MCQs, not the theory books, as well as the dance notes, and they founded the basis for about everything which I did in the internship.
Well, that's nice. And what about the time management? Because time is the biggest constraint when you're preparing.
Time was pretty difficult, especially in MAMC, as the internship is pretty time consuming. However, I did study, I just studied regularly. I didn't even, it wasn't, okay, I would study 24 hours a day or whatever time I could get. I would relax, I would take my breaks, but it was just persistently keep on studying up to whatever you can. And that was just what I did.
So utilizing all the useful moments you had with
Yes,
you.
yes.
That's very nice. I think that's very important also. All my viewers are listening to this and taking home a very important message. So how was DAMS important in your preparation?
Dance was pretty crucial. Right from the third year when I joined the foundation course, Arvind sir's and Rajiv sir's notes in medicine and surgery, not just for from the MCQ point of view, but from even from the theory point of view. In my final year, those notes helped a lot, and most of my concepts from medicine and surgery were developed in those classes. Besides that, Deepthi ma'am's notes were pretty comprehensive, and I don't think there is a question which has been asked outside of those notes in Obs and Gynae. Sumay sir's classes uh, were among the ones which I really enjoyed.
That's very nice to know. May I ask you here, Dr. Saman, was your study more selective or was your approach a more extensive kind?
In internship, you have to be selective. You have 4 years worth of subjects which you have to consolidate into 1 year, and then again revise all of them in the last 1 or 2 months. So you have to be selective. You have to follow what has been asked, what the teachers tell you. For example, in DAMS or the DAMS exclusive club. So that all you have to do, not extensive.
Oh, that's very nice to know. And can we have your inputs on the DAMS exclusive club?
The dance club was very nice. In that, you could just put your doubts on Facebook, and they would eventually be answered, and that too by the respective faculty members. Besides that, Diksha ma'am's updates for pathology, the HND, gave me more confidence for the AIMS exam, where they do ask a lot of biopsy and HND specimens. And besides that, whatever updates we will get, the recent changes in the policies and the most common controversial questions, they were also always updated on the group.
Well, let me remind my listeners, my viewers here, I'm talking to Dr. Samman Verma, rank 22 PGI Chandigarh November 2016 postgraduate medical entrance exam, and rank 34 in AIMS November 2016 postgraduate medical entrance exam. As we all know, that DAMS conducts a DVT session every year at Talkatora Stadium. By any matter of chance, did you appear or did you attend that?
I could not attend it because of my internship postings. I had heavy duties those days. However, I did hear from my friends that it was pretty good and pretty useful.
Well, definitely yes. And another fact you missed out here is that you missed out to be a part of a record-holding performance done by DAMS in the DVT session. I'll just briefly tell you that this year we have done exceedingly well in the DVT session, with the record number of doctors being a part of it at the live session, and we have entered the record books for the country for this particular session. Well, anyway, carrying on to our CBT. Did you take it? How was it?
Yes, I gave the CBT. I actually got a rank of around 600. So what is supposed to be a morale booster came more of as a reality check, and it encouraged me to study more. And it also obviously what its main purpose was to give you a feel of the examination, and to know that even if you do not know most of the questions, not most, like even if you do not know 15, 20 questions, you can still attempt the other ones properly and do them and not panic during the exam.
I see it was more than a booster encouragement for you from 600 in CBT to rank 22 in PGI and rank 34 in AIMS. Wonderful. Then we do have tests conducted for our students. We are talking of the grand test, subject-wise test, semi-finals, mop-ups, etc. Can I have your feedback on the same?
Yes, I gave the grant test as well as the AIMS mock examination, so they were pretty good. I think there were at least 3 or 4 questions outright directly from those grant tests which were asked in the AIMS examination, and that's a lot because in AIMS even every single question matters.
Yes, it does.
And the fact that you could just give them at your home while sitting on the bed or whatever, they were useful, and you could revise all the important questions.
Well, that's very nicely put here. And let me remind once again to my viewers and my listeners that I'm talking to Dr. Samman Verma, rank 22 PGI Chandigarh, November 2016 postgraduate medical entrance exam, and rank 34 in AIMS, November 2016 postgraduate medical entrance exam. Samman, you just mentioned that you joined a foundation course in DAMS, and you are a Maulana Azad student, right?
Yes.
So would have been a lot of time that you have spent with DAMS, probably 2 or 3 years if I'm not wrong. What difference did you feel in yourself, during this time from the day of joining DAMS until the day of exam?
The main difference from the DAMS perspective was obviously my grasp for medicine and surgery. Those were the subjects which I would attribute a large fraction to DAMS for whatever knowledge, especially of surgery. Rajiv sir's lectures were brilliant. And besides that, orientation towards the MCQs, what they ask, how they ask, what are the more important topics, that was all discussed more in DAMS.
Well, you get more oriented and more focused towards the examination. Well, that's very nicely answered, and thank you very much for your kind words. Which faculty at DAMS did influence the most to you?
As I said, Arvind sir and Rajiv sir and Sunil sir's classes. Those were the ones which I really enjoyed and probably the best.
Have you made up your mind to pick up a branch, or are you still taking your time?
I want to take a medicine, but let's see what rank and what options I get further on. But I do really want to take a medicine.
Well, let's wish for the best, and let's hope for the best as well. We'll definitely pray for you, and I hope you might get whatever you are seeking in life. All the best for that. And before we wind up this conversation, any messages to your juniors regarding joining DAMS?
Joining DAMS' foundation course was pretty nice. It was a good move and helped understand the basic concepts. Besides that, there is a lot of free time in third year which can be utilized in DAMS. And otherwise, the TND, although I did not join it as such or attend very frequently, I've heard it's very good and very comprehensive.
So you suggest that they should join DAMS?
Yes.
Thank you very much. And here it is. We were talking to Dr. Samman Verma, rank 22 PGI Chandigarh, November 2016 postgraduate medical entrance exam, and rank 34 in AIMS, November 2016 postgraduate medical entrance exam. Thank you very much for talking to us. Dr. Samman, we wish you all the best in life.